Away. My name is Ron Shaw. I'm an internist and currently the CEO of the Osage Health Center here in Pawhuska, Oklahoma, on the Osage Reservation. I want to talk to you today about considerations when you're deciding whether or not to take the COVID-19 vaccine. You know, there's 2 vaccines available now. We've started vaccinating here at our clinic, as are other tribal nations. But the individual, American Indian individuals trying to decide whether he or she wants to take certain risks that they see as associated with submitting to a vaccine that hasn't undergone the full approval process as other vaccines. I think one of the important considerations one needs to take when they're deciding whether to take the risk of the vaccine or the risk of acquiring COVID-19 and its possible lethal complications is this. We believe, and data is supported by the Centers for Disease Control and Prevention, that the incidence of COVID-19 is 3.5 to 4 times higher in American Indian people than it is in non-Indians. Important to consider that your risk as an Indian person is higher, not just the same as the non-Indian people that may live in your area, but you're higher. We're not sure what that is. We don't know what genetic or racial or other backgrounds may help increase that risk, but that's an observed fact. Also, hospitalizations and mortality is higher among American Indians. So as you make your decision about deciding whether to subject yourself to the risk of a completely unproven or completely proven vaccine versus the risk of acquiring COVID-19 and possibly hospitalized and dying, you need to realize that there are risks of not taking the vaccine, like dying from COVID-19, being put in the hospital, or perhaps acquiring it and giving it to other members of your family or your elders. So please keep that risk in mind, that it's not just risk of the vaccine. What are the risks of not taking the vaccine and getting COVID-19 and becoming a source of contagion? So hard to decide. I think each individual will make his or her own mind, but you are not at standard risk of COVID-19's complications of requiring it. As an American Indian, you have a much higher risk. So please take that into account as you make your decision. Thank you.